My name is Dr. Robert Schmidt, and I'm a facial plastic surgeon. Botox is the #1 most common procedure done for cosmetic purposes in the United States. It's more popular by a factor of 6 than soft tissue fillers, which are the second most common procedure done in the United States. Botox takes about 10 to 15 minutes to do, and we have you make expressions as we go to try to show me exactly where you need Botox to help with fine lines and wrinkles. You wouldn't necessarily see anything in terms of effects for about 3 to 5 days, and it takes about 2 weeks to be at its maximum. But properly done, the effect from Botox can be very subtle. What you don't want is a situation where you have Botox done and then now I'm happy, or now I'm upset. You want to still be able to make expressions, but just things are a little bit softer. And what that will do is it helps to soften the fine lines and wrinkles in your crow's feet area, between your eyes and in your forehead. Sometimes we need to bring you back in a couple of weeks to just recheck the Botox and make sure it's perfect. And if a little touch-up is needed, we take care of that for you. Especially when we're first beginning a relationship together, it can take a couple of treatments for me to 100% specifically get what your face needs. But after a couple of treatments, usually we don't even need to touch things up afterwards. Soft tissue fillers come in a lot of different strengths, and we use them for different purposes. We use very thin fillers for very fine lines and wrinkles, and we'll also use those to plump lips. Now, lip filler gets a bad rap because there's so many people walking around with duck lips, and it doesn't need to be like that. It can be a subtle thing, and it just has to do with using our judgment for picking the right filler for the job, but also in how it's placed. We have a new way of doing it now that involves cannulas that have a blunt tip to them. So there's many fewer needle sticks and a lot less bruising, and the recovery is a lot easier. Done properly, lip filler can be subtle. You definitely don't want people talking about you, but you want to be able to look better, and for people who have naturally thin lips, we can make it a little bit better. Other common ways that we use soft tissue fillers are in the deeper folds of here, and then to help to camouflage early aging changes around your mouth. Most fillers will last anywhere from 6 to 9 months. There are some that last a year or more. In some cases, you have a lasting benefit that can be permanent, but we'll talk about that when you come in.
Hi, I'm Toni Martinez. Dr. Schmidt's a longtime friend of mine. I love coming to see him. He always makes me feel beautiful when I leave. One of the reasons I love coming to Rob is he listens to my request, then he tells me if he thinks it's a good idea. He's not one of these doctors that just does things on you because he can make money. He does things that are necessary to help you look better and feel better. So for people that are afraid to do anything cosmetic, I've been doing this since I was in my 30s, late 30s. I've always had deep forehead creases, so I used to have to go all the way to Houston to have this done. It was such a pleasure to meet Dr. Schmidt when he came to Bryan College Station and to be able to do everything locally. So not only do I save 4 hours out of my day by coming here, just the care and the treatment that I'm given here at the Face Place cannot be beat. I love coming. One of the things I love about Dr. Schmidt is I'll always say, can we just do a little more? And he'll say, no, I want you to look natural and beautiful, not fake and plastic.
I'm Dr. Robert Schmidt, and I'm board certified in facial plastic surgery, and I can't wait to start a relationship together.